Good afternoon. My name is Lucy Aquino, Chief Executive Officer of Hispano Care, a program of Advocate Illinois Masonic Medical Center and affiliated with Gottlieb Memorial Hospital. Today, you are watching a live interactive show on Cable 21 CAN TV. During the next 25 minutes, we will be discussing PAD, and we'll be telling you what that is in a second. We invite you to call in with your questions. Our lines are now open. The number is at the bottom of your screen, area code 312-738-1060. Joining with me today is Dr. Mark Caldo. And Dr. Caldo is a vascular surgeon, bilingual vascular surgeon in English and Spanish, and on staff at Illinois Masonic Hospital. But first, allow me to say thank you for being on the show.
Thank you for having me.
Well, this is great. I know it's an interesting topic what we have going today. A lot of questions. When we see and we talk about vascular surgeons, we imagine heart surgery. We imagine everything that has to do with the heart. But sometimes we don't really know what else you do in addition to all these other things. But Dr. Caldo, what it really is a vascular surgeon? Let's get into some detail about that. What do you really do?
Well, to separate it, to start, I am not a heart surgeon. A cardiovascular surgeon is a heart surgeon. It does open heart surgery, bypass surgery on the heart itself. A vascular surgeon, also known as a peripheral vascular surgeon, is a surgeon who's first trained as a surgeon and then specializes in the vascular system. So anything after the heart, specifically the blood vessels going up the neck to the brain, the carotid arteries, the main blood vessel going down the body called the aorta, the blood vessels in the legs, the arteries going and giving blood to the lower legs and the feet. Any of these blood vessels that have problems can have surgery to correct these problems. And in addition, also veins in the body. People have various types of vein problems in their body. So arteries and veins are the main things that vascular surgeons specialize in and deal with.
And of course, spider veins, obviously, varicose veins is something that I think you do a lot of.
That's right. That's a very common vein problem. Spider veins are those little tiny veins that women typically have in the lower extremities. Usually that's a cosmetic issue, and we can treat those with small little injections in the office, outpatient procedures. And varicose veins are the other vein problem that you frequently hear about. Those are those bulging veins in the lower extremities or the legs, and sometimes those can actually cause people pain. So those can also be treated with minimally invasive procedures.
So Dr. Caldo, when we talk about PAD, now we hear this term a lot. You hear it in commercials, you hear it from physician's office, you see it written on a lot of pamphlets. But what exactly is PAD?
Well, PAD stands for peripheral arterial disease. And what it is all those arteries I was just talking about earlier that come off of the heart, whether it goes to the arms or up to the brain or to the legs, those arteries over time can develop plaque, the buildup of plaque on the inside of the blood vessel. And various reasons that people get plaque buildup, and we can get into that in a little bit. But basically, the plaque that builds up can cause lack of blood flow to the legs. And people can get various symptoms in the legs from that. And peripheral arterial disease is that buildup of plaque in the blood vessels going to the legs. And it can be treated with various things, and starting with medication, in the worst case scenario, surgery.
Right. Now, we also know that if PAD is left untreated, it can cause heart attack and stroke.
Absolutely. Peripheral arterial disease is focusing on the lower extremities or the legs. However, when people have arteries in their legs that get plaque formation or buildup of plaque, which causes narrowing or blockages of the arteries, that process is most likely going on in other parts of the body. So it could be happening in the carotid arteries going to the brain, and those people are at risk for getting stroke. It can happen in the blood vessels around the heart, and that's why people get chest pain, lack of blood flow to their heart, and end up having a heart attack. And they can also have other blood vessels in the body, blood vessels going to the intestines, blood vessels going to the kidneys. Wherever it may be in the body, that organ that the lack of blood flow can have damage.
Which obviously then also can lead to gangrene and or amputations.
Absolutely. For the leg specifically, the worst case scenario is people end up with an amputation. And that's my job, is to help people
Make sure it doesn't happen.
treat the problem early so they don't end up with an amputation.
Right. So what are some of the risk factors of PAD?
Number one is smoking. Most of my patients over the past decade smoke, and they smoke a lot. So that is one of the largest areas that we can work on as a community, is to help people stop smoking. Mm-hmm. Smoking causes damage to the lining of the blood vessels, and it facilitates plaque formation, and it accelerates that process. So smoking is always number one. Other areas are diabetes. See, if you look at the lower extremities, as the main blood vessel comes down the body, it splits and goes to each leg. And one main blood vessel gives us blood down to the leg, and then below the knee, it splits into 3 blood vessels and goes all the way down as 3 smaller blood vessels into the foot. Mm-hmm. Atherosclerosis is the hardening of the arteries, or the building of plaque. So that is anybody, as we get older, as we get in their 50s, 60s, 70s, they're going to develop plaque buildup in the bigger artery in the thigh.
So the older you get, obviously, the higher the risk.
That's
at
right.
Advanced ages.
That's correct. Diabetes is another issue that attacks the blood vessels, but it attacks the smaller blood vessels. It specifically attacks the blood vessels that are smaller below the knee, those 3 vessels that I told you about that split. So diabetics tend to get the small vessel disease below the knee, where the smokers and the people that have higher cholesterol, those vessels that are affected are typically the larger blood vessel aorta and the arteries going to the thigh, the large blood vessel.
So obviously causing, especially with diabetics, is a poor circulation.
Exactly.
So you hear this term all the time. You have poor circulation due to diabetes complications.
That's exactly right. So what's really bad is if you have diabetes and those small blood vessels are being damaged, and then now you're a smoker on top of that, now you've got a double whammy.
But then you also have those with hypertension and or high cholesterol.
Absolutely. And now you could have 3 or 4 or 5 things going against you. Mm-hmm. And that's what a lot of my patients have, the ones that end up needing major surgeries for example, bypass surgery in the legs to restore circulation, or the patients that end up getting late to the doctors, and it's too late, and we can't save their leg, and they end up getting amputations above or below their knee, and they lose their leg. Those are the patients in general that have multiple risk factors. Mm-hmm. They're smokers. They may have diabetes, high cholesterol. They don't exercise very much.
Low physical activity.
Absolutely.
Couch potatoes that many of us have become.
Absolutely. And that is one of the things that you can do to protect yourself from PAD, is exercise. We know that over many years and years of studying in the medical community, that if you take cholesterol-lowering medication, you protect yourself from heart attack, and you protect yourself from peripheral arterial disease. So that's one of the most important areas, is lowering the cholesterol, whether it be with the medication. Also, exercise lowers your cholesterol. Right. There's 2 types of cholesterol. There's the bad cholesterol, called LDL. You want that to be low. And then there's the good cholesterol, HDL, and you want that to be high. And exercise is one of the most important things that will increase your HDL, or your good cholesterol.
Now, I think one of the other risk factors, obviously, is heredity. Family history of vascular disease. Something that everyone should really know about their family background. Absolutely.
That's one of the first thing I ask the patients is, does anybody else in your family have this problem? Because if both parents or the siblings, as they get older, have this problem, it's very likely that this patient is going to also have this problem too. So hypertension, which is high blood pressure, high cholesterol. Some people just are more prone to having high cholesterol.
Sure.
These things can be genetic and run in the family. So that's actually a very good point.
Right. And then in addition to that, I mean, we also look at the world in which we live in. We're eating a lot of fast food. People are not really cooking at home like they used to. We're not eating what we're supposed to be eating and watching what we're eating, but a lot of fast food. So those are the things that I know that we should pay more attention to, in addition to what we eat and what we put in our bodies. So, doctor, what are some of the symptoms that individuals should look out for? What should they be watching out for, especially in their legs?
So the first thing when people get lack of blood flow to their legs is a phenomenon called claudication. And what that fancy word means is lack of blood flow to the muscles. As you walk and as you exercise, your muscles demand more blood, more oxygen, more nutrition. And if you don't have good blood flow, or if you have poor circulation or PAD, you end up not delivering enough blood to those muscles in your legs. And people first complain of, after they start to walk 1, 2, 3, or 4 blocks, whatever it may be, they start getting pain in their calves, usually both sides. It could be worse in one leg or the other. And then they stop walking, the pain goes away, and then they resume walking again. And some people go on like this for months and months or years and years because they don't realize that this is a underlying vascular or lack of blood flow problem. But that is one of the earliest signs of peripheral arterial disease.
Having that pain in your calf, walking and resting, it goes away and it
Correct.
comes back.
Correct.
And obviously, when that happens, and it continues to happen with the constant pain, even at rest, some of the worst case scenarios is that wounds may also develop from that as well.
That's right. We call it critical limb ischemia or tissue loss, where the blood flow is so bad that now the skin especially in the foot, sometimes it's the toes, it can also be any area on the foot or the lower leg. The blood supply is so bad that there's not enough nutrition getting to that skin and that muscle, and the skin can start to break down and they form open wounds. And if the open wounds are definitely from lack of blood flow, this is called critical limb ischemia, and these are the patients that are extremely at high risk of losing their leg and needing an amputation surgery.
Right. Now, and we see this all the time in community. I mean, individuals, as you mentioned, people start getting used to living with pain. They start getting used to, walk a little bit, I hurt a little bit, but that's okay. It'll go away after a rest for a while. And I hear it all the time.
Right. That's exactly right. I hear that. And some, like you said, certain cultures are also, the Latino community is one of them. Latinos are very tough people. And compared to some other cultures, they don't complain very often, to be honest with you, especially the elderly Latinos.
Right.
The ones that are maybe grew up in Mexico, in other countries, and now live in the states that I've seen. These patients don't complain. No. They're not complainers.
They keep it to themselves.
They keep it to themselves. Right. They may have these complaints. They just don't even tell their family, or they just don't even think it's a problem.
Well, they don't want to worry their loved ones, and they figure they'll be a burden to them and everything else. So obviously it's something that's kept very quiet. I do want to remind our viewers that today with us we have Dr. Mark Kaldal from Illinois Masonic Hospital. Thank you again for being on the show and talking about such an important topic. And to remind our viewers that our lines are open. If you have any questions, please give us a call. The number's at the bottom of your screen, area code 312-738-1060. Dr. Kaldal, we talked a little bit about the pain and the blood flow, and we talked about the potential of sores, obviously, coming out from that. But can we talk about some of the problems that you treat in communities as a whole, patients as a whole, but not just the Latino community, but community as a whole? We talked a little bit about how Latinos tend to not speak up and not to follow up. But let's talk about some of the things that actually affect or blockage of the arteries. Can we go into a little bit further detail about that?
Yeah, we talked about diabetes. Diabetes is a very difficult disease to control. Many patients as people start to get older in their 30s and 40s, people are not used to going to the doctor in general, Latinos and non-Latinos both, because as we're younger, we're healthier. As we get older, if you don't end up going to the doctor and getting some basic screening tests, like your blood sugar or your fasting blood sugar, after they have you not eat overnight, and then they check your fasting blood sugar. If these are abnormal, this could be early signs of early diabetes, or the patient can have full-out diabetes. The problem is with diabetes is we do prescribe medications. We do tell people to eat lower sugar diets so they can keep their blood sugars in normal levels. However, when we give patients insulin, which is a shot under the skin they have to give themselves multiple times a day, it's very difficult to do day in and day out. So the Latinos and other communities, controlling the diabetes into a nice range of blood sugars,
Right.
so the diabetes doesn't damage the blood vessels, is difficult to do. And some people honestly just get lazy, or they've got other things going on in their life with their job or their children, and they just don't take care of themselves. And even though they saw a doctor,
Right.
and we're giving them the appropriate tools of diet control, pills to control the diabetes, or insulin, sometimes they just don't do a good enough job taking care of themselves. And I do notice that a lot, especially 40 and 50-year-olds that have busy family households, and they're too busy taking care of their children and trying to make dinner, trying to go to their jobs and pay the bills,
Right.
and they end up not taking care of themselves.
But we do also know, too, that it really doesn't have to get that far. I mean, there's what we're calling these days, you're calling these days, is pre-diabetes. I mean, obviously, if you have symptoms, if you know that it runs in the family, it is part of the family history. Now, they do say that diabetes is hereditary. This is something, too, that if you know it runs in your family and you know that you might be at risk for this, definitely something to check with your doctor while you're in their office. If not, take advantage of the free screenings that are throughout the community throughout the year that are happening all the time if you're not sure. Come in and take advantage of that. But definitely check. I mean, you don't have to wait to be on insulin in order to prevent. I mean, all of this is preventable for the most part.
Absolutely. And if it's not 100% preventable, it's definitely 100% manageable and 100% treatable. We should also mention that diabetes doesn't only affect the lower extremities. Since we're talking about diabetes affects small blood vessels in the body. The small blood vessels in the back of the eye, people can go blind and lose their vision. The small blood vessels that supply the kidneys, so people can end up getting kidney failure and end up going on dialysis. They can get small blood vessels damage in the legs that we talked about. Kidney,
Heart disease.
Heart, and the heart, another one. Exactly.
I mean, it's one of those diseases that is manageable and preventable if done correctly with exercise, nutrition,
Absolutely.
diet. A lot of this is preventable. So Dr. Caldo, what are some of the things that can be done to help patients, and what are some of the treatments that are available for PAD?
Well, most patients that come to me with PAD, they have the pain in the calves that we talked about earlier, or also called claudication. Those patients, the majority of them are smokers. So what we do is we go into a lot of time counseling the patient on stop smoking, and we counsel them on how they can stop smoking. The reality is, if you take all the smokers,
Right.
if you have them all quit, 80% of them will resume smoking again,
Wow.
despite medications or support groups, etc. But even though 10 or 20% of people are successful at quitting smoking, we still have to try.
Right.
And maybe it'll take someone multiple times to realize they need to quit smoking and try. It might take them 2, 3, 5 times over years, but at least
Right.
the
trying.
process is started. It's trying.
Right.
So that's one of the big things, is we tell them to quit smoking, and if they're not exercising, at least walking 3 to 4 times a week, just walking a nice 30 to 45 minutes, and actually walking until they get that pain
Right.
in their calves, and
Right.
then walk through it. And that will actually develop new blood vessel formation, and they'll get more blood flow to their legs.
I think what you just said is actually key, is that most folks, at least that I come across in community, and even what you said, is walking through that pain. Most folks will stop, rest, and then maybe resume again, but not walk through the pain itself.
That's right.
Doctor, we have a caller. Yes, caller, you're on the air.
Hello.
Hello.
All right, good evening to both of you and to the doctor, of course.
Thank you.
Hello.
Okay, you're more than welcome. I have a copy of my lab report, and I'm trying to understand two situations here. Now, my lipid profile, which is below the cholesterol, the number is 242, and the triglycerides is 313. So would that be borderline diabetic?
So the lipid panel has really nothing to do with diabetes. We have to separate those two out.
Okay, then what about the cholesterol? It's 242.
Those numbers are, I'll tell you, those numbers are on the higher end, okay? Now, Diabetes is specifically looking at blood sugar or glucose. So that is a separate thing. These numbers you're giving me are not talking about diabetes.
Oh, okay. Well, then I follow you. Then the glucose is, let's see, comprehension metallic panel, and then it says glucose 108.
108's normal.
Oh, so I'm in good shape.
Well, there's two things. 108, that's good. And I don't know if you did a fasting or not. So the true way to test for diabetes is the patients have to fast overnight and not eat anything after midnight. And when they wake up, they go and get their blood drawn, but they don't eat in the morning. Then that is what's called a fasting glucose. That is the real way to check for diabetes. Oh. However, that being said, your blood sugar, whatever time of the day you had this checked, regardless of when you ate breakfast or lunch.
You know what, doctor? I did not eat breakfast on that specific day.
That's good, but that number is good.
Okay,
108 is pretty darn normal. That's all I can tell you.
Oh, thank you so much, because I was concerned listening to your program.
No,
I was really
your sugar,
concerned. And thank you to the both of you.
No problem.
Oh, you're welcome.
Have a
Thank
good
you
evening.
for calling.
Bye-bye. You're welcome. Bye-bye.
Bye-bye. Great question.
Good question.
Good to know.
Yeah, absolutely. And that's good to know, because sometimes we talk so quickly, as in the medical world, that we should be clear. Diabetes is an issue with glucose, which is blood sugar.
Right.
That is what we were talking about for diabetes. And what this caller was talking about is lipids or cholesterols and fats. And those are important numbers to check also.
Right.
And her numbers were a little bit on the higher side. Okay, I don't know if I got a chance to tell her that, but hopefully she's still watching. So her numbers were a little on the higher side. So she might be a candidate for a special medication that can help lower the cholesterol, and it can help lower her risk of heart attack, stroke, and PAD also.
Well, doctor, before I forget, I want to remind our viewers that if you have any questions or would like to reach Dr. Mark Caldaw, vascular surgeon associated with Advocate Illinois Masonic Hospital, his number, he can be reached at 773-296-3390. Again, that number is 773-296-3390. Now, Dr. Caldaw, obviously, if you're talking to all those viewers out there who are watching us today, and if you can give them one good piece of advice, all the advice you gave them today is fantastic and everyone should listen to it. Stop smoking. Would that be your number one advice? Especially when we're talking about cardiovascular or PAD in this case, and walking through that pain, right? Get over to that threshold and walk it off.
Yes, agreed. Stop smoking, please. Please stop smoking.
We have a caller. Caller, you're on the air.
Hello, Doc. Yes, I'd like to ask you to kind of expound on that topic you were explaining about the fasting versus not fasting, and what actually happens when one is eating before taking a glucose test. How does that affect the blood, and what's actually put into the blood that affects the result?
Sure.
Okay, caller, we will answer you. Thank you.
Yeah, that's a good question. So when people eat food, whether it be candy or regular food, there's always sugar in food. It could be an apple, it could be a sandwich, whatever it is. So when someone eats food, all that food gets absorbed in the intestines, and that puts a lot of sugar into the blood. So if you check your sugar anytime around eating, in general, even my own blood sugar, and I don't have diabetes, will be high. So that will look like an abnormal number. However, you just ate, so the blood sugars fluctuate, go up and down throughout the day, which is normal. So the only way to really know for sure what your sugar levels are is don't eat overnight, and that's called fasting when you don't eat. And when you wake up, you go get your blood drawn in the morning when the lab opens, and that's called a fasting glucose. And that number means something to the doctors, because that number says, hey, this is really what this person's blood sugar is without eating for the last 8 to 10 hours. And that we can see, is it really high? Is it normal? And we can go from there.
Well, Dr. Caldaw, our time here goes by so quickly. Sometimes I wish we had hours in the day to keep discussing this important topic and the topics that Hispano Care and Advocate Illinois Masonic Hospital brings to community. But And I still had so many more questions for you, but our time goes by so quickly. And then this is where I have to say, Dr. Caldwell, I need to bring you back. We have to continue this conversation.
No problem. I'd be more than happy
Well,
to come
I
back.
thank you so very much for coming out. And in closing today's show, I do want to leave you with this thought that we all experience pain to a greater or lesser degree at various points of our lives. And it is said that the pain that is most common reason for patients who seek medical attention. So on that note, on behalf of all of my colleagues at Hispano Care, Illinois Masonic Hospital, Gottlieb Memorial Hospital, and Dr. Mark Caldwell, thank you very much for watching and allowing us to share this time with you. Until next time, we'll see you in a few. Please stay tuned for a lot more important information coming your way. Thank you for watching.